Welcome, everyone. My name is Peggy Nolte. I'm at the University of Arizona, and I'm currently serving as the chair of the Consortium of Neurology Education Coordinators. Thank you all for attending. I want to go around and introduce our board and our admin for our group. So I think we'll just let you guys do introductions. So Laura, do you want to introduce yourself? And
hi, everybody. My name is Laura Gwynn, and I am coordinator at the University of Michigan. I've been a coordinator for almost 5 years now, and I love what I do.
Laura is our chair-elect, which will start in 2022. And I don't see Chris Berry on here. Is she on here yet?
No, I don't see her yet.
Okay. Chris Berry, who will be joining shortly, is fellowship coordinator and clerkship coordinator at Duke, and she's the current chair-elect. So she will start her term as chair in July of 2022. And Lucy, you and Brielle would like to introduce yourselves?
Sure. Lucy Prasad, I'm the Associate Director for Trainee Education at the American Academy of Neurology. And Brielle is my a coordinator on my team and oversees this consortium. So Brielle, I'll let you introduce yourself.
Hello, everyone. My name is Brielle Woff. As Lucy said, I am the Trainee Education Coordinator here at the American Academy of Neurology, and I'm really excited to be here with you all today.
Great. I don't want to waste any more time. I want to have this presentation started. So what we're going to do is have a presentation, and then we're going to break out into rooms and we can discuss this journal club article. I'm very excited to introduce you to our two presenters today. First, we have Melissa Crisp, who is CTAGME certified, and she's at the University of Toledo. And as well as we have Caroline Martin, who is an education specialist at the University of Iowa Health Center. So without further ado, we'll turn it over to both of you.
Thank you, Peggy. So the article that we're going to be discussing today actually falls under coordinator wellness, in that it touches on the magnitude of burnout in program administrators, or PAs as the article refers to them as. PAs include any individuals who position involves administration of either a residency or fellowship training program. Next slide, please. So we are all obviously very familiar with the topic of burnout and how it affects our residents and fellows, how we need to address this in our trainees. So burnout really isn't a new term to us by any means. It's actually been around since it was coined by Dr. Herbert Bergenberger back in the 70s. And he described burnout as a consequence of severe stress and high ideals in jobs that were deemed helping professions. And it was later expanded and defined as a syndrome consisting of 3 different elements. And this was actually focused on individuals providing care for patients. Those 3 elements: emotional exhaustion, depersonalization, or the mental and emotional separation from one's work, and a feeling of reduced personal accomplishment and feelings of ineffectiveness. Now, burnout was found to be linked to several negative side effects, which I have listed here. Reduction in productivity, poor sleep quality, an increase in alcohol and drug misuse, high turnover rates, and looking specifically at patient care, we know that there's a negative impact on quality of care when our trainees are burnout. Next slide, please. So we are very familiar with how this affects our physicians and trainees, but what about us? What about program administrators? Well, there have been several studies that have actually been conducted that show that burnout is actually contagious. So it affects other members of the healthcare team. And since we worked with our residents and fellows, it kind of trickled down, and we feel that. As of the publication of this particular article back in August of 2019, there were no known national studies on the prevalence of burnout in program administrators. Next slide. So the aim of the study that they conducted was to assess the degree of burnout in program administrators and the association it had with their rate of turnover. All program administrators were able to participate in the study, so it didn't matter if they, if their program was accredited, it didn't matter what specialty they were from, if they were full or part-time, none of that mattered. So it included all program administrators. And the way that notification of the study and survey were handled, where it was distributed via email with the assistance of representatives from PA specialty associations. So they used their membership roles to kind of solicit interest in this study. And the content of this survey that they sent out covered questions under demographics, wellness activities, so whether their institution provided any type of wellness activities geared specifically toward program administrators. And then it also included questions from the Copenhagen Burnout Inventory Tool, or CBI. And the CBI actually includes 3 independent scales of burnout. And if you look at the next slide, I pulled a screenshot from the supplemental document that was provided with the article. And it shows you the 3 different types of burnout: personal, work-related, and client. And here, client obviously is referring to residents, fellows, students, or interns. So you can see the different questions that were asked under each category, just to have a better idea content-wise what was included. So in addition to this, they asked all participants the same question. In the last year, have you thought about resigning your position due to increased workload or work-related stressors? And then respondents were able to answer either yes or no for that particular question. Next slide. So an unknown of this study is the exact number of PAs nationally. We don't know. It was estimated at the time to be about 10,000. And out of the almost 1,100 participants that emailed the study, 904 actually completed the survey. And this was estimated to be about 11% of all PAs nationally. And as you can see from my stats here, the majority of participants were Caucasian females from the Great Lakes and Southeast region. 60% actually had at least a bachelor's degree and were employed at least 8 years in a medical education setting. Next slide. So looking specifically at CBI scores by specialty, which they had a really nice table in the article, you can see that the neurology fellowship and OB-PAs actually had the highest personal burnout scores compared to any other specialty, while gastro-PAs had the lowest. Neurology PAs actually demonstrated an elevated work-related burnout score compared to other specialties. And out of all 3 scales, personal, work-related, and client-related burnout scores were actually the lowest. And looking back at that question that they asked everyone, have you thought about resigning due to increased workload or stressors? Nationally, 52% actually reported having these types of thoughts. And they did find in the study that there was a difference in the 3 different burnout category scores among those who had thought about resigning and those that had not. And they also found a strong association between having thoughts of resigning and the number of years that they've worked in the medical field, the number of years in their current position, and whether or not wellness activities were offered at their institution. And while 91% expressed interest in actually attending wellness events, only 14% noted that their institution actually offered anything that was specifically geared towards program administrators. Next slide. So we see that the results show PAs who actually thought about leaving had higher personal, work-related, and client-related burnout scores than those who had not. And they actually found that PA specialties showing the highest CBI scores mirrored those of their specialty physician counterparts, which was pretty interesting, I thought. And then we see that there are some shared factors between program administrators and physicians regarding burnout, and those are work overload and low support in the role. Now, looking specifically at physician data, it shows that burnout is a major driver of turnover for physicians, and those physicians that expressed an intent to leave actually correlates with their actual departures. So something we don't really know well right now, because it's not well studied, is the impact of program administrator departures. Okay, we don't know how that affects the program financially or otherwise. But what we do know, when a program administrator leaves a program, it takes a lot of time and energy. When you have to hire someone new, you have to take them through the onboarding process, you have to train them. This is a huge burden on everyone, including the program, the trainees, and the faculty. Next slide. So Caroline is actually going to be discussing how we can address or minimize these shared factors.
Okay, thanks. So yes, I'm going to talk a little bit about ways to mitigate burnout. So in the article, we know that the two main factors that really lead to burnout are work overload and low support at work. So I'm going to talk a little bit about some techniques, methods to alleviate these two items. Next slide, please. And can I get that? Yep, thank you. So there are, on the program level, a couple different things that can be addressed to help alleviate the feeling of coordinator burnout in their role. And a couple of these items are things that should really be done up front before a coordinator joins their position, ideally. And the first one would be communicating clear job responsibilities and priorities. So this would really be going beyond what is listed in a job description and communicating to that person, that coordinator who's taken on the role, what their job duties are, what their priorities should be. Because I know, I'm sure everyone will understand this, but when you first enter a new job, you aren't always crystal clear on what your responsibilities are, and you'll have tasks thrown your way that you question, should this be my responsibility or not? So really clear communication of those duties so you can mitigate the feeling of burnout. And along with that, the department, number one, should be providing thorough training and mentoring for the coordinator in their role. And I think the GME office at your institution can also really help with this in providing kind of supplemental training for coordinators, so they better understand how their role works and how they should function on an institutional level. And the next item that the program can do to avoid overloading a coordinator in their role is to look at the accreditation body guidelines for that particular role. And I know depending on the subspecialty, these can vary pretty widely. But for example, the ACGME has guidelines for example, the neurology coordinator role, where actual percent of effort is spelled out according to number of trainees in the program. So that's something that programs and departments should be looking at to ensure they're not overloading coordinators in those particular subspecialties. And the last item on the list would be seeking student job support for those lower level tasks. So things like, making copies, putting packets together, those tasks that you can kind of delegate out to potentially a student worker can really help to alleviate your level of stress so you can focus on big picture items. Next slide, please. So at the individual level, there are additional things you can do when you're starting to feel burned out in your role. So number one would be make sure you set boundaries. And I know for myself, this is really hard to do, but for example, when you're off hours on the weekend, on after hours, I would really encourage people to not check their email. I know it's very easy to get pulled in after hours, but for me, I really try to avoid checking my email or looking at my email after hours on the weekend. So that's my time to do fun stuff and not work. Another thing would be on your set lunch hour, make sure you take your lunch hour, make sure you're taking breaks. And during those times, if someone knocks on your door, say, I'll get back to you later. This is time for you to take a break and kind of distance yourself from your work for a little bit. So that's really important. Another thing is to feel that it's okay to say no. You don't always have to agree to take on new projects that are asked of you. So this would really go back to having a clear understanding of what your job duties and responsibilities are. I know a lot of us get additional asks within our role, asks for help with projects. So recognize that it's okay to say no to certain projects. You don't have to take on everything. Make sure you have a good relationship with your manager. And if you feel you're struggling, if you feel you're overloaded, make sure you're communicating with that person and talking to them. Many times your manager can help you to come up with solutions, maybe to better utilize your time or to even offload some additional tasks. And lastly, make sure you're using vacation time. Again, I'm just speaking from personal experience here. I know I have a tendency to not want to use my vacation time. I feel like I have so much I need to get done, but it's really important to take a breather, take time away from work and make sure you're using that time. And I think there were maybe a couple extra bullet points on there. Yeah, so these are things I'm sure you've heard already, but make sure you're getting enough sleep, make sure you're getting exercise, because these things can help you physically feel less stressed. So important things to remember. Next slide, please. Okay, so in supporting the role of the coordinator, there are multiple groups and people that can really help to provide support for the role. Number one would be your department, your program, and your GME office at your institution. So I talked a little bit about that, making sure that at the department level, the coordinator is getting the training, thorough training that they need for their role. And then at the GME level, knowing that the GME office is there to provide additional support and training for the role. Also at the institutional GME level, and this varies from institution to institution, but there are often advisory groups within the GME office or committees that you could consider joining as a coordinator to get to know other coordinators within the institution and just forming that support group. Making sure as a coordinator you're joining recurring meetings. For example, if your GME has a monthly meeting, making sure you're joining that. And then any retreats or workshops that are offered by your GME, making sure as a coordinator you're involved in those. And then lastly, there are multiple national organizations geared toward education coordinators. This one is a perfect example, the CNEC. A couple others are the AHME, the Association for hospital medical education, the ACGME is another one, and then the Massachusetts Society of Academic Medical Administrators. And this is not just for people in Massachusetts, this is for all medical administrators. But I think overall, just knowing that there is support out there for coordinators at the institutional departmental level and at the national level, and really working to build a sense of community is very important, so you don't feel isolated in your role. Next slide, please. Okay, so on top of kind of building that feeling of community among coordinators, mentoring is especially important. Again, you can look to the institution, the GME level, and your own program to find mentorship opportunities. So again, this really varies from institution to institution, but at the GME office level, some GME offices might offer mentoring lists where you can find available mentors to kind of reach out to for support. And even at the departmental level, you should look for mentoring opportunities. And it might not even necessarily be within the education department. I know I seek out our department administrator a lot for questions, insight. So I really look to him as a mentor, and just, again, reaching out to other people for support so you don't feel isolated in your position is very important. At the national level, there are other mentorship opportunities. So for this particular group, we are working on a mentorship list. So you will eventually, that will be publicized. So you'll be able to find residency, fellowship, and clerkship mentors that you could potentially reach out to for certain topics. For example, if you have questions about how site visits work, there will be a go-to coordinator that you can reach out to for that. And then keep in mind that there are Facebook groups out there for coordinators. They vary. There are groups for clerkship coordinators, groups for residency coordinators, and then just an overall education coordinator group. So again, those are really good sites to reach out to, take a look at those Facebook groups, because there's a lot of really good knowledge out there. Next slide, please. Okay, and then I wanted to talk a little bit about wellness options to mitigate the feeling of burnout. So again, variable by institution, but GME offices at institutions will often offer, or sometimes, not often, I should say, offer wellness activities geared toward coordinators. So this could be in the form of workshops or retreats. It could be social activities outside work where you just meet up with other coordinators to have a drink, for example. And then at the institutional level and the departmental level, there are often other wellness opportunities that you can seek out. I know at our institution, we have an initiative called Live Well that provides support for healthy living and a lot of really good wellness resources that are available to coordinators and everybody at the institution. And then separate from that, there are often at institutions counseling services that are offered for all staff that are out there as additional resources. I think as this article really highlights, and you'll notice from the data and some of these surveys from the article, there's really a need for more coordinator-specific wellness offerings at institutions. I know at my own institution, we're just starting to gear up and work with the GME office to create more wellness activities geared toward coordinators, because right now they really don't exist. Next slide, please. Okay, so looking to the future, and again, the article talks about this toward the end, there really is a need for further study to look at how effective these efforts are in really alleviating feelings of coordinator burnout are implementing these different ideas to alleviate burnout. Are they successful in helping to retain program administrators? That's something that would need to be looked at in a future study. Next slide, please. Okay, so before we move on to breakout rooms, we just wanted to open it up for any questions that people have. And I see we've got some stuff coming through in the chat, but if anyone has questions, please feel free to enter it in the chat or even unmute.
So Caroline, someone was asking about, I'll go ahead, Candy was asking, does anyone have any neurology coordinator groups they are part of? I'm a new coordinator as of this academic year, so. Do you want to answer that?
Yeah, so the first one that comes to mind for me is there is a neurology specific Facebook group out there. I'll look up the exact name of that and I can enter it in the chat. Oh, and Peggy, you mentioned that.
So I mentioned that I'll have to get the name of it too, right?
Yeah, that's the first one that comes to mind other than this group. And Rachel says there's a child neurology coordinator group with the Child Neurology Society. Any other questions anyone has? Oh, thank you, Peggy. Yeah, that Facebook group is a really great group. It really, anytime you have a question, just enter it there and you always get a good amount of responses and feedback. It's really nice. Yeah, especially during the write.
So Brielle, do we want to go ahead then and we're going to break out into rooms and just discuss this article, whatever, you know, we have someone leading each group and we'll have a few minutes to discuss this. Thank you again to Melissa and Caroline for sharing that information. That was a really great presentation and it was so relevant and true. So Brielle, we're going to move on to the next one?
Yes, if anyone has a really quick, maybe 30-second summary of what their group shared, that would be great. Otherwise, we can move forward, but if I welcome anyone to share if they'd like to.
Anyone?
So our group kind of concentrated on shared experiences and just what their institution offered. Wellness activity wise, if they had any type of mentoring program or coordinator advisory group. And then we just kind of shared our own personal experiences.
Great, thank you, Melissa. So if no one else would like to share, we can definitely move on. Okay. So I have some quick AAN updates for you all. We recently had quite a few awards and scholarship deadlines pass, but I did want to bring your attention to our recently opened Medical Student Prize for Excellence. This is a prize for graduating US and Canadian medical students, and they can be nominated for it. Applications close January 31st at 11:59 p.m. Central Time. And I will follow up with a link to that application. I really encourage you all to share. And then I also wanted to highlight some upcoming events. We have Neuroscience is Rewarding Day taking place on November 30th, the whole day. And then also on November 30th, we have our trainee and faculty networking panel that takes place from 4:30 to 5:30 p.m. Central. And then on December 7th, we have our CNPD virtual conversation corner that takes place from 4 to 5 Central Time. And then our virtual resident education lecture series will be on December 9th from 11 to noon Central. So I will follow up with an email and provide links to all of those events for everyone. Are there any questions in the chat? Kathy, I see that you asked, will the presentation be sent to us? And yes, I will follow up with the slides from the presentation, specifically from the Program Administrator Burnout presentation. Any other questions? Okay. I think that was everything we had. Did you want to add anything, Peggy?
Yes, Celia wanted to announce something.
Hello, everyone. I'm Celia. I'm a clerkship administrator here at University of Central Florida in Orlando. And we got a grant to just survey, understand site descriptions and how they meet the LCME. Our credentialing body is the Licensing Credentialing Medical Institution, LCME. They're the ones that give us the accreditation to actually be medical schools. They do it for everyone. And we just want to survey you guys to make sure that, or to find out if our site's descriptions are actually within LCME standards. Hopefully we could get enough data to maybe present this information to you guys in an LCME type of presentation at the AAN meeting or even one of these. So I sent the survey in the chat. If you're a clerkship administrator, clerkship coordinator, or anything to do with neurology clerkship, if you can complete that survey, I greatly appreciate it. We just need a little bit more information or a few other people to fill it out. For those that did fill it out, thank you so much. That's all.
Great, thank you, Celia.
Thank you.
Does anyone else have any announcements? Well, I think this was a great presentation. I think that the data was very accurate. And it was, I might just share our group, there were 7 of us and 4 of them were very new coordinators. So I encourage you, whether you're brand new or you've been doing this a while, is to reach out to each other and support each other. If you have questions or you just want to share. But if no one has anything else, I guess we can adjourn, give you guys 4 minutes back in your day. Thank you, everyone.
Thank you.
Thank
Bye-bye.
you. Bye.